don't count as that vote. Okay. We did have a meeting on March 9th. If somebody else pops on, I would like to get a motion to accept that meeting. God, March 9th, that was before COVID happened and life was kind of normal back then. So it's hard to remember things back that far, but you know, for government purposes, we will need to accept those minutes, but we will need one more. And we also had a meeting on November 9th. We did not have a quorum at that meeting, so technically we didn't have a meeting. It was more of a discussion. So we'll get back to that part of the meeting once somebody else pops on. Kevin, can you give us a report from OEM or somebody from OEM?
Sorry, hi Bruce, it's Kevin Fries. Our report is, you know, we're working on helping the Board of Health with staffing and coordinating volunteers for all the different points of dispensing for the COVID-19 vaccine. We are also continuing our resource distribution. We're actually in the process right now of moving a bunch of the PPE that's at the distribution center into the new storage facility that we built. So hopefully we'll have that done this week. And then we are working on pushes of PPE to various providers over the next couple weeks. And that's about it for us.
Okay. Any questions for Kevin in regards to any of those topics that he mentioned or anything else on for OEM? Okay, being none, we'll move on to grants. I don't see anybody from grants. Nope. Bill Davis, anything on airport?
Nothing really on the airport right now. We are planning the annual triennial disaster drill that's going to be coming up in 2021. We're still working on all the dates and everything else like that. It's probably going to be held sometime around September, August, September.
Okay. Cleveland EMS. I don't see anybody from EMS here per se, but Dr. Collins, is there anything you can report on EMS?
Will be the same as the building term and one of those things that we are vaccinated our members of the EMS fire. Some of what the county is on and is well we will be transitioning to the regional protocols in the very near future. We have that class extension up and that class has only been instructed on new regional protocols. So we are not going to have an option the transition. Other than that, I have nothing to report.
Okay, Dr. Collins, you were pretty broken up during that. I'm not sure if anybody picked up on anything.
I couldn't hear anything either.
Okay. Is there any chance you could try one more time, Doc? Thanks anyway. Andrea Bishop, anything from Health Affairs that you would like to report on?
Hi, everybody. Can you hear me?
Yes, very good.
Okay. We've just been available to support the operations for COVID as we're asked, just following the hospital's bed numbers and such, and attending meetings and sharing information. So we've been doing that. We've also been working on one of our grant deliverables this year was to create a burn surge annex to the regional healthcare response plan, which we completed a draft version with the support of the Metro Health team. And we have to do a tabletop exercise to test that plan. We did the same thing last year with a pediatric exercise, but the Ohio Department of Health was the one that hosted the pediatric, so there was very limited people that could participate. But because of COVID, they have tasked us with hosting and facilitating the tabletop. So it's a pretty short timeline and we're going to do it virtual. I don't know if anybody from this committee would be interested in observing or joining the tabletop itself. It's going to be on February 10th in the afternoon, starting at 13:30 and hoping to get done in a 2-hour time frame. We're actually having a simulated, similar to what happened in Fairport Harbor a few years ago. There's a gas overpressurized gas lines and explosions, and the closest hospital, it's going to be in the city of Geneva because they required a critical access hospital. So we're going to have a bunch of explosions occur close to UH Geneva, and we have to talk through notification. Then the next module is heavy patient distribution. There's going to be eventually, as the scenario builds, about 300 burn victims. So we have to kind of talk on how these patients would be distributed from the scene, where they're going to go, how we prioritize them with that. So NAD's going to be there, of course. We asked for UH's transfer center to join to kind of talk through the details on how we would actually coordinate the care of those burn patients and where they're going to go. And then the last one is a discussion on this coordinating with the state level. So if anybody's interested in that, I don't know if Bruce, if you wanted to be on that, or Jackie, if you wanted to listen in on that, let me know. It's a short time frame, but we're pulling that together. Other than that, the zone call this morning, if you hadn't participated, the numbers pretty for Region 1 and Region 2 seem to be going down. Region 5 is still kind of steady as she goes. So we're just kind of, and all the hospitals are administering their vaccines that they've received. And that's all I have.
Okay, thank you. Any questions for Andrea? Okay. I don't see Rebecca or Heidi from the Board of Health. As you could probably gather, they've been kind of busy lately. I know that they have had several, been part of several clinics, vaccination clinics. They had 3 for fire in EMS. The last, between Christmas and New Year's, they had 2 days last week that they did it to the 1A group. That worked out really well. I was there one of the days and helped out with that. I know each day they pushed out about just under 800 vaccines for both of those drive-in sites. And they're having another one on Wednesday, also at fairgrounds. So they're looking for some assistance. I'm not sure if those roles have been filled yet. Maybe Kevin, if you're still on, if you know how the numbers are looking, we can get out some else out.
Yeah, so there are, I believe, 3 spaces left for this coming Wednesday at the fairgrounds. And then out at the Euclid E-Check station this coming Saturday, we just finalized everything for that. And there's some spaces available for that as well that Chief Sweeney will be sending out the link to register.
Can we get that if you have it? Would you mind sending it out to us today so I could send it out to folks?
Yeah, so it should be coming out from Chief Sweeney to the Chiefs Association for vaccinators for Saturday.
I'll forward that to your attention, Dr. Spanner, as soon as I get that.
Thanks, Bruce.
Get that information.
Thank you.
So we need 3 vaccinators. So if anybody knows of anybody that can help on Wednesday, then check your emails for from Sweeney. You're going to be looking for the same. They're really going to be relying hard on police and fire here, especially in this initial stage with the 1A group, maybe the 1B group. You know, so hopefully you guys can help out and get some information out to your medics and allow them to assist. We don't want to burden the same people, every single time. So hopefully we're spreading the wealth a little bit and helping out with that. And then before you know it, we'll be ready for our second dose in like 2 weeks. So I'm sure that they're working on some planning for that as well. So, and lastly, I just sent something out to my general public. The Board of Health has a very good COVID website. It talks about where they're at with the vaccination process. So if any of your city leaders or fathers or anybody that wants to know where we're at and what they're doing, I would refer them to their website. And, last week I was in a meeting with Rebecca, and even though the governor may have made some announcements for Class 1B and some other folks, Cuyahoga County just not going to be able to keep up with that schedule. They're still vaccinating the 1A group. I know, like in Lake County, they're already signing up for the 1B. We're not even there yet. We haven't even done our law enforcement folks. So, so we're going to be a little bit behind the curve, is what they're making an announcement to the state of Ohio. So just make sure that your folks know that this is a big county, a lot of moving parts, and you need a little bit of patience and getting all these people vaccinated that need to be vaccinated in the 1A, and then we'll start working on 1B. So.
Hey, Bruce, do we have a number? How many have been vaccinated so far between the 3 spots?
So there were 3 sites that was vaccinated for the county fire department, and I believe that there was, Kevin, was there about 700? No, there was about 1,500 people total for those 3 days, and about another 1,500 people for the other 1A group. And that group included still fire and EMS if they missed the first time around. I saw lots of like group home folks, special needs type people that are in homes, doctors, dentists, a lot of those folks that were coming through the site that one day. I know each day they had just under 800. That was at the county fairgrounds. So I'm sure that they're looking for about the same this coming week. And obviously there's going to be a lot less at the e-check station, since there's only going to be a few lanes, I would imagine, that they can use. But obviously that group does not include the hospitals who are doing their own vaccinations. These are just vaccinations for the 1A groups that are not associated with the hospital or medical facility that has their vaccines. And then also those that include the nursing homes that CVS and Walgreens are taking care of. So these are a good number of folks that are not associated with that. And also, this does not include the city of Cleveland. The city of Cleveland does their own vaccinations with Cleveland Board of Health. So I know like Cleveland EMS and fire and police and those folks are working on their doing their own folks. So those they are not included in this in these groups. But I'm sure obviously if somebody missed it, they would be welcome to come to this. But I know that the numbers that I mentioned don't include what Cleveland has done as well. So there's lots of moving pieces. It seems like every day there's a new update, new site, additional vaccination site. So, check your emails and help out when you can. It's really a benefit to the community. Jackie, what do you have for CCOMs? Anything to report on that?
Not really a whole lot from CCOMs. We've just been participating in the weekly COVID talks, and our focus has really been on working with the PSAPs and information sharing and modified questioning and things like that. And I've also been keeping track of guidance and posting it up on our EMS hospital website to try to keep all that most recent information up there for anyone. I'm just working through the COVID.
You guys are doing a good job. Appreciate everything that you're doing, working with our doctor groups and the protocol committee and everything else. So we'll get a report on that in just a moment.
Thank you.
David Yarmish, Todd Baker's not here. Is there anything on NOTS that you are aware of that you can report on?
We're meeting on NOTS quality next week. The symposium in November was a tremendous success. Went to a virtual platform. There were over 1,500, I believe, people signed up and ended up with over 1,000 formally attend. So for the 10-year anniversary, by all rights, just a tremendous success. Not too many operational hiccups, and aside from that, looking at planning 2021 and maintaining some sort of virtual presence, because one of the positives that did come out of COVID would be the larger breadth and depth of an audience, attracting providers and clinicians and EMS and fire personnel from out of state and even a couple other countries. So it definitely would be classified as a tremendous success. So other than that, nothing else to report on NOTS.
Okay, very good. Thank you. Any questions for David Yarman? All right, thanks, Dave. Jackie, back to you. Want to give an update on the EMS protocol update?
So we just met prior to this meeting, and basically what's going on right now is finalizing changes that would have been in our 2020 revision. Unfortunately, COVID put a little damper on that timeline. So we will be finalizing revisions. A 2021 version will go out in March, early March, maybe even sooner if we can get that all squared away. We are going to work on developing a process or a schedule in which we will be posting changes and things like that. Basically, we want to make sure that we streamline the process, have the process of making necessary changes and getting that out to everybody. We want to make that more so that we don't have anybody kind of falling behind. So we are working on putting those things together. And like I said, we should have everything finalized for this next revision. It'll be out by March.
Dr. Spanner, Dr. Collins, Dr. Sato, you guys have anything to add to that?
Pretty much everything Jackie just said, we talked about kind of in detail as far as the updates that people will be seeing will be lowering the recommendation of double sequential, removing the rescue pod, removing epinephrine dopamine drips and starting epi pushes, starting Pitocin for obstetrical after delivery and prevention of or dealing with postpartum hemorrhage, upgrading TXA. I think that's pretty much everything. I'm sure there's others, but that's what we covered at the meeting. And, the drafts have all been written by Scott and sent out to everybody. So this should go pretty rapidly.
All right, guys, thank you for your input on that and working on this. I think it's going to be a good change. We haven't had any changes in quite some time. We haven't actually had a lot of meetings due to COVID. So it's nice to get this group back and get folks in the room and have these discussions and finding out what the latest trends are and drugs and so there's quite a bit of good stuff coming out. So chiefs kind of expect the protocol to come out in, like Jackie said, in early March. I would imagine some training will come out beforehand on what the changes are. But most of these changes are going along with the new AHA standards and changes and a couple drug changes as well. So, all right, no further questions on that. Jackie, there's nothing to report on the EMD, is there?
No, that project got put on hold
Okay.
due to COVID. So we're trying to get back into it.
Okay, yep. On old business, the MCI trailer for the county, there's a few of them out there. We're still in the process of receiving. We haven't received any equipment yet, but the equipment has been ordered. Once I receive all the equipment, I will be making arrangements to update the equipment in the trailers, not only in Cuyahoga County, but in Lorraine, Geauga, and I think Ashtabula too. So there's a couple of counties that requested equipment. So I'll be making arrangements for that. The old equipment that we take out, like the expired chest shields, for example, and the expired equipment, we could use for training or any kind of RTF type of training or things like that. So, so the equipment won't be thrown away. We'll hang on to it, and Brian Kloss and maybe some of his groups can utilize that for some of RTF training is perfect for that. I don't have any other old business. But for new business, we need to vote on a vice chair for this committee. I don't see him on, but Chief Tom Mound from Brook Park has been working with me for years, and he's been the vice chair of this committee for several years now. I like to reach out. Well, number one, we don't have enough people to formally vote, but I want to reach out to him to see if he's interested before nominating him. If he's maybe some of the other chiefs on it, I haven't seen Tom around lately. Is he still active? He didn't retire or anything, did he?
No, he's still around, and now would be a good time to nominate him and put him in since he's not here.
Absolutely.
Yeah. I would like to nominate him and see if I want to make sure he's interested in it. I'm sure he will be. He's been an advocate for EMS, and he's worked with many of these docs over the years in his roles, from way back, with Dr. Spanner and some of Dr. Collins and all these group doctors he's worked with. So I just, I haven't really heard much from him. I guess I need to reach out to him to make sure he's interested. And by next meeting, we'll make sure we can vote in that position. So we're going to hold off on this topic at this time.
Fun Tom Mound fact. He actually talked about 5 of us from Physicians Ambulance into jumping out of an airplane.
Did he really?
Absolutely true story.
That sounds like something he would do too. So any other announcements or business, anything miscellaneous business or announcements that anybody would like to make? All right, see it none. Our next meeting will be on March 8th. By then we'll have a couple protocol meetings to report on as well. The new protocol probably will be done by then, which would be good. If there's no other questions, I guess this is adjournment. So I appreciate your guys' time and making time to sit in this meeting. And hopefully next meeting we can get a larger group in here and do a little bit more and be able to present a little bit more information. So appreciate your time, everyone. Have a good one, and we'll see you at another Zoom.
Have a good day.
Thanks, Bruce.
Hi, everybody.
Bye.
Okay.
All right. Thank you. Bye-bye.